So with my research, I work in the Women's Health Research Program, and our program studies a broad range of areas of women's health, particularly women at midlife and older. So we cover areas as diverse as cardiovascular disease, cancer, bone health, diabetes, a whole range, really anything that affects the health of women at midlife. So I've worked together with Sue Davis in the Women's Health Research Program since 2003, and in that time we've covered a broad range of research topics. I think one of the things that I think we have contributed, which is really important, is establishing normal values for sex steroids in women using very high quality assay methods. So one of our most highly cited publications, and I think now it's up nearly at 500 citations, is just reporting what are sex steroid levels in women over their lives, so from young adulthood into old age. And that's been, I think, a very, very important contribution from our group. So the women in that study were quite representative of Australian women from the community, and that has become, as I say, a highly cited reference in relation to midlife women's health. Yes, one of the other, I think, really important pieces of work we've done is a cohort study of women who were newly diagnosed with their first episode of breast cancer. So we recruited to that study nearly 1,700 women, and we've now followed them actually over 10 years. And the women in that study have been just remarkably loyal to that study, and to date we've published 23 publications from that piece of work. Yes, I think the most useful piece of advice I could give a young researcher is, firstly, I would encourage them, if they're interested in research, to pursue a research career. I would advise them, though, to think very carefully about the area that they want to work in, and particularly to look for and find a research group to work with. I think working in isolation is really problematic. So I think finding a comfortable research community to work with is really important in terms of both support and also maximising productivity.